Well, hey guys, happy Friday. So for the Q&A today, I thought I would address all of your questions about stretch marks, everyone's favorite topic. They're quite common and nobody likes them. And so it's not surprising that I get many questions about how to get rid of them, why do they occur, what can be done to prevent them. I get questions from women who I just found out they're pregnant and they want to do things to try and avoid getting them. So today I'm going to address all of those questions. If you're new here, welcome. My name is Andrea. I'm a dermatologist. I film day in the life, fun vlogs of my day-to-day life, as well as a lot of plant-based recipes and skincare Q&A. So if that type of content is of interest to you, then subscribe for all the fun. Now, the medical term for stretch marks is stria, and there's something called stria gravidarum, which is specifically stretch marks of pregnancy. And then stria themselves are kind of broken down into two presentations. There is stria rubra, so when stretch marks first appear, there are stria rubra usually, or red stretch marks, and then with time, they become skin colored to white, and that is referred to as stria alba. And a stretch mark is technically a type of scar, an atrophic scar, because the underlying supportive collagen framework of the deeper layer of the skin, the dermis, has been disrupted. The collagen and elastin fibers have been stretched and disrupted and not allowed to go back to their normal assembly. And therefore you're left with kind of a stretch, a stretch in the deeper layer of the skin that's almost like a shot elastic in a waistband. Have you ever shot the elastic out of the waistband in pantyhose? Does anyone wear pantyhose anymore? Probably not. But stretch marks are kind of the same thing happening in your dermis, okay? And they look sort of like little wiggly rivers or almost like wood grain at times. They can happen, obviously in pregnant women on the abdomen or anyone on the abdomen, particularly after weight gain, weight loss, rapid changes in weight. They can happen on the thighs, the buttocks, the upper arms, and particularly in people who lift weights and make a lot of gains very quickly, can develop stretch marks. So sudden increases or decreases in body mass that the skin stretches to accommodate that can result in stretch marks forming, which think of them as basically a type of scar that almost happens from within as a result of stretching. So why do stretch marks happen, or a few reasons why they might occur? Well, I already mentioned that, it's almost kind of twofold actually. So first and foremost is just a structural occurrence from rapid stretching, whether that be weight gain, pregnancy, bodybuilding, that interferes and disrupts and agitates that elastic fiber network in the deeper layer of the skin. But it's also genetic. Some people are genetically predisposed to developing stretch marks, and we don't know what the genes are or the genetics behind stretch marks, but it appears that some people are genetically susceptible to them. So, like people swear, well, my mom had stretch marks, I'm going to get stretch marks. There is a better chance that will occur, because there does seem to be a genetic element to it as well. So rapid changes in weight definitely are a predisposing factor, but no, it's not just pregnant people and people who lose and gain weight that develop them. Another factor in the development of stretch marks seems to be hormonal as well. Men can get stretch marks, and we know that taking testosterone supplements, say for bodybuilding, seems to increase the likelihood of stretch marks developing. A lot of teenagers can develop stretch marks as they're going through puberty and their, kind of hormones are raging. So it's not that changes in hormones can affect just some of the normal turnover, the rapidity of the turnover of the deeper layer of the skin, and lead to stretch marks. And then importantly, medications that can cause stretch marks would be systemic corticosteroids, okay, like prednisone, for example, can definitely, unfortunately, cause stretch marks. Quite disfiguring stretch marks, actually, and something called Cushing syndrome, just side effects of chronic, of having to be on steroids for a long period of time for a disease. That is an unfortunate side effect of those medications. But in addition to systemic steroids that you take, like prednisone, topical steroids can also cause stretch marks. It's a side effect of prolonged use of topical steroids, particularly when the individual is using them on, like, say, normal skin. Then the steroid doesn't really have anything to do but wreak havoc. And the risk is correlated with not only the potency of the topical steroid that the individual is using. You know, the steroids that are sold over the counter, like 1% hydrocortisone, are much weaker and lower risk, but it can still occur. Whereas clobetasol, another steroid cream, is much stronger and much higher risk. Okay, so it's the potency of the steroid in the cream itself, and then the location on the body where the cream is being applied is another risk factor for the development of stretch marks. So if the individual particularly is putting them in areas of the body that are under occlusion, like in the armpits or in the groin area, those are high risk sites because they're kind of constantly under occlusion, and can drive it into the skin a little bit better and just set the stage for stretch marks. And then also the vehicle that the topical steroid is in can also increase the likelihood. So if it's a ointment, meaning kind of the consistency of Vaseline, then that is more likely to put the individual at risk for developing stretch marks with chronic unnecessary use of the cream, of the ointment, as opposed to a cream. But it can occur with any of them. So that's why I always tell you guys, follow up with your treating dermatologist, because there are side effects associated with prescription and over-the-counter steroid creams. And, a lot of people buying steroid creams from online pharmacies and using them and self-treating with them, this is a real risk. You can develop disfiguring stretch marks. And stretch marks are very hard to get rid of, as I will elaborate on. Everyone wants to know, of course, how to prevent stretch marks. Because the stretch marks are, they have a genetic component. Unfortunately, they're very difficult to prevent. And, obviously rapid changes in weight are a predisposing factor that, if you could try and avoid, like crash dieting or rapid weight gain, but that can be difficult. I will underscore the fact that if you're using a steroid cream, make sure you follow up with your the prescribing physician to make sure you're not developing those side effects and that you're using them appropriately. And if the disease you're using them for has stopped, then they're being weaned off appropriately so that you don't put yourself at unnecessary risk for that side effect. So that's an important measure. People swear up and down by all sorts of moisturizing creams, shea butter, cocoa butter, oils, you name it. People swear by it and say certain things work, but all of the studies that we have, we really can't come up with anything that actually prevents stretch marks. So there have actually been some studies looking at cocoa butter, and it doesn't seem to make a difference. But people swear up and down by cocoa butter as a preventative against stretch marks. Just anecdotally, patients swear by it. I've obviously never been pregnant before, but friends of mine have and use it because they don't want the stretch marks. And some of them develop stretch marks regardless, probably because of their genetics. Some of them didn't develop the stretch marks, probably because of their genetics. But ultimately, I do think that moisturizing the skin in some manner can help. But suffice it to say, we don't have a oil or moisturizing ingredient that is good in a stretch mark cream as a preventative. Okay, there's no such thing. There's no such ingredient. We don't have any data for that. But very recently there was a big, what's called a Cochrane review of all of the studies on stretch marks, and really there was nothing that was demonstrated in all of the studies to be preventative. So, however, once you develop stretch marks, how can they be treated? Well, there are a few treatments. Most of them are procedural or things that you have to pursue within a physician's office. So a prescription cream that can be helpful is prescription tretinoin, which I have whole videos on, a whole playlist of Q&As on tretinoin if you're curious. But tretinoin is a prescription retinoid cream that can actually, first it kind of helps exfoliate the skin a little bit, and maybe kind of rejuvenate the top appearance of the scar or stretch mark. But it can, with long-term, I mean, we're talking years use, it can strengthen the dermis, the deeper layer, and improve the appearance of stretch marks. Stretch marks, atrophic scars. So that's something that could be prescribed off-label for stretch marks that has been shown to be helpful. It's not safe to use during pregnancy, so you'd have to wait until you are no longer pregnant to use it if stretch marks in pregnancy is what's going on for you. So that can be helpful. I also get questions like, what about Differin? Could I use that? Differin also should not be used during pregnancy, by the way. But Differin, it works on slightly different receptors, so we don't have the data that it works to kind of boost collagen production in the deeper layers of the skin like we do with tretinoin. It seems to work more in kind of the acne category of things, but it's probably a better bet than like a cosmetic retinol. And if you're curious as to the differences, in my tretinoin videos and my tretinoin and anti-aging, I kind of describe the differences between tretinoin and Differin, as well as the retinols like what's in Paula's Choice, Rock, Ordinary, all of those retinol serums. How those are different than tretinoin, how those are different than Differin. But at the end of the day, tretinoin, possibly with long-term use, can subtly improve the appearance of stretch marks. We have some data for that. However, stretch marks are not only frustrating for you, but they're also frustrating for the dermatologist because they're pretty difficult and stubborn to treat. Probably the best bet is lasers, though, in terms of treating them, so it can be quite costly. And typically the individual needs somewhere in the ballpark of like 10 to 20 laser sessions to get good improvement of the scar. There are a variety of lasers that can be used. I'll have a whole video on lasers, by the way, if you're at all interested in just some more information on lasers and lasers for the skin. But laser therapy is probably your best bet. It's going to be pretty expensive, though. It takes about 10 to 20 treatments. There are a variety of different lasers that are going to target different parts of the stretch mark. So when stretch marks are red, stria rubra, the physician would probably select a vascular laser like V-beam, for example. That can help the redness go away. And then as far as helping with the textural appearance of the stretch mark, resurfacing lasers can help. Fraxel can help as well. And Fraxel can probably help boost the collagen under the scar a little bit. And then, there is a laser called Excimer that when the scar is kind of white and shiny a little bit, that particular laser can help in terms of repigmenting it a little bit, but these are all kind of subtle improvements. They require multiple treatments, so it's kind of a costly investment to get rid of them. There are a lot of light-based devices that you can buy on the internet or on eBay or Amazon that claim to be helpful. I wouldn't waste a dime on these. The outputs of these kinds of things are incredibly variable, and they're not regulated in any way, and they don't seem to work at all. So I wouldn't waste any money on those if I were you, but to each his own. So I don't recommend those kinds of things. I would go to somebody who has the actual laser, and I would go to a board certified physician who in dermatology, who has some laser fellowship training, perhaps. Ask them what their credentials are, because they're going to best be able to select the most appropriate wavelengths to optimize the revision of what is essentially a scar, your stria, your stretch marks. So that would be my overall kind of gestalt of how best to take care of these. There are a lot of gimmicky things, creams, ointments. None of that I would really get behind for these. Honestly, I think you're just spinning your wheels. I wish there was more in the realm of stretch marks. It's something that we take very seriously and are always trying to come up with better therapies. So stay tuned, but I hope this video was helpful. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.